The Inflation Reduction Act was just passed earlier this week, and it is going to have some definite impact upon the healthcare industry. In this video, I'm going to explain how this legislation can have impact upon you, especially if you're on Medicare. Now, for those of you that are under 65 and could be covered by an Affordable Care Act plan where you're receiving cost sharing and a tax subsidy, what this legislation did, it expanded those benefits as well as extended them all the way through December of 2025. So they added 3 more years to the ACA subsidies. Now, when it comes to Medicare, there were several changes that were made, and these will be enacted over a period of time. And so let's start with January 1 of 2023. The first thing we're going to see is that there will be certain insulins where there will be a maximum copay of $35. Now, that just simply means that if you're on that particular insulin that is going to be part of the Medicare insulin program, the most you would pay out of pocket would be $35 when you go get your insulin. Now, what you have to realize is that Medicare is not going to cover all insulins, but any medication that they will cover that's going to participate in this program beginning January 1, 2023 will not cost you any more than a $35 a month copay. Also beginning in January 2023, the government is going to impose an inflationary control upon drug manufacturers, which means drug manufacturers will still be able to raise their prices, but it will be limited to the amount of general inflation. If they raise their drug prices anything beyond the general inflation numbers, then they're going to be penalized by a form of a rebate that will have to be given back to the government for their excessive price increases. So again, that's going to bring some price stability to the cost of all medications because there will be a limit on price increases. Hey, just real quick before we get to the next part of the video, I just want to remind you to like, subscribe, or put a comment there in the section below and ask any questions that you would like us to address. And then just one more thing, you'll find down below in the description, there's some links there where you actually can schedule an appointment to talk to one of our Medicare guides. So if you need further advice, look at all your options, we'd be happy to help with that as well. And then lastly, beginning January 1, 2023, adult vaccinations are going to be included at no cost. Now, presently, if you're on Medicare, Medicare does cover at zero cost to you pneumonia, flu, hepatitis B shots, as well as COVID shots. And those have been at zero copay. There's no cost sharing at all. But other adult vaccinations that are covered by Medicare B or D, there's always been some kind of cost sharing. And now all those medications that are considered to be adult vaccinations that are necessary, meaning medically necessary, will now be covered with zero cost sharing. And the biggest impact, of course, will be the shingle shot. Presently, the shingle shot is covered, but there is a cost sharing involved. Could be a deductible, could be a copay, and that will be eliminated in January 1, 2023 for all adult vaccinations. Now, this next change is going to start in January 1 of 2024. Now, to really understand this, I do have to give a little bit of explanation about it. If you're on any kind of a Part D plan, a drug plan, whether that's a standalone drug plan or one that's embedded within the Advantage plan, you have 4 stages, and those stages represent 4 different possible copays that you would be responsible for your prescriptions. You actually could be on one medication on a Part D plan that could change prices 4 times throughout the year. So we have 4 stages. Those stages are, number 1, the deductible stage. This year, that's $480. Then we go into what's called the initial coverage stage, where you just simply pay a very reasonable copay. But if we ever reach a certain retail threshold, that puts us then into stage 3, which is called the coverage gap, or we call it the donut hole. And then the last and final stage is called the catastrophic stage. And all drug plans have those 4 stages. What is going to happen in 2024 is that 4th stage, which is called catastrophic stage, will go to a zero out-of-pocket expense for anyone that reaches catastrophic. Presently, it's a 5% copay. Okay, that means that if a medication was $1,000 right now in catastrophic stage, stage 4, you would pay $50 for that medication. But in 2024, what will happen is that copay would be zero. So if it's a $1,000 medication and now we're finally in the catastrophic stage 4, you would pay zero out of pocket for that. So the point is there will be zero cost sharing now once we reach the catastrophic stage beginning in January 2020. And the other change that's occurring in 2024 is Medicare will allow the Part D plans, those companies that provide insurance for your medications, they do allow them to raise their prices. But what's going to happen beginning in January 2024 all the way up to 2030, this legislation says they can raise those Part D premiums no more than 6%. There's been no limit on that up to this point in time, but now they're going to cap that out at a 6% increase for Part D plans beginning in 2024 all the way to 2030. Then that brings us to the year 2025. So what's going to happen in 2025 is Medicare is now going to set an actual max out-of-pocket on prescription drug expenses. So in other words, the max out-of-pocket means once you've reached that amount, you can put your wallet away. Everything will be zero thereafter. And so beginning in January 1, 2025, the max out-of-pocket will be $2,000. Okay, so at this point in time, people could literally spend $10,000, $15,000 out-of-pocket. But beginning in January 1, 2025, the max out-of-pocket for anyone that's on a Part D plan, remember whether that's standalone plan or embedded with the Advantage, would spend no more out of their pocket than $2,000. Once they've reached that limit, then Medicare and the plan will actually pay the remainder of the cost. Now, the big change that we're going to see beginning in January of 2026 is now Medicare will be empowered to negotiate for prescription drug prices. Because of legislation actually was passed back in 2003, Medicare has not been able to actually negotiate prices on costly medications such as chemotherapy and multiple sclerosis drugs, rheumatoid arthritis, a variety of meds, blood thinners, those kind of things that are very costly. The government has been prohibited through Medicare to be able to negotiate prices. Now, what's interesting is Medicaid's able to do that, and the VA is able to do that, the Veteran Administration, but Medicare has not. And so what that means, those that have been able to negotiate have actually saved their recipients about 32%. But again, that was off limits to Medicare. But beginning January 1, 2026, what's going to happen, this legislation empowers Medicare to negotiate. Now, that list will be determined by Medicare, but it's going to be basically those that are very costly drugs. In 2026, they're going to be able to identify 10 different drugs where they can negotiate. And then in 2027, they'll be add 15 more drugs to the list, plus Part B covered drugs. Part B covered drugs are ones that you don't self-administer. You actually go to an outpatient facility, or those are meds that are covered while you're in the hospital. That's Part B covered meds. And so what will happen now in 2027, they're going to add to the list, plus include Part B medications as well. And then in 2028, they're going to add 20 more drugs to the list where they can negotiate prices. Then every year thereafter, if there's a high-cost medication, they can add to that list of negotiable prices. Every year they'll add 20 more meds that they then indeed can negotiate. Okay, so it's a wonderful way for the Medicare to be able to save really literally billions of dollars, because now they can negotiate those prices down and save themselves money as well as Medicare recipients. Now, as part of this legislative work, there also came out of it some not so good news, and that is what they're saying now is that by the year 2028, the Part A, or the hospital insurance fund, will only be able to pay about 90% of its obligations. Now, the government certainly can improve that and change that so they can get back to 100%. But at this point in time, if we get to 2028 and there's no changes, they'll only be able to pay 90% of their obligations. So certainly there needs to be some change there. So that's not so good news. And the other piece of bad news that came out around the same time is that there were some that were trying to get Medicare to include some dental and vision and hearing benefits, but that was not included in this particular Inflation Reduction Act. So again, that's still on the table as lawmakers still negotiate how they're going to bring dental, vision, and hearing benefits into the Medicare space. And then lastly, the good news out of this legislation is there's going to be an expansion of the eligibility for the financial assistance that people can receive for their Part D plans. These are called low-income subsidy plans, or extra help. And so right now, those plans are very limited to only those that have very low income and hardly any assets. And so what's going to happen is through this legislation, they're actually going to expand the eligibility. They're going to raise the income levels as well as the assets and resources that people have, meaning there's going to be more people that will be eligible for the extra help program, which is wonderful because there's many who really do need that sometimes cannot get their medications because they just are a little bit over that qualification, and now there'll be more that will be able to get Part D extra help.